Hey everybody, happy Monday. Now because Halloween is coming and many of you have asked about these diagnoses, today I'm going to talk about phobias. What are they? Why are they so upsetting? And most importantly, how can we overcome them? First, let's talk about how phobias are diagnosed. In the DSM, the Diagnostic and Statistical Manual of Mental Disorders, all phobias fall under the diagnosis of specific phobia. Now, in order to be diagnosed with specific phobia, we must meet the following criteria. Number 1, we have to show a marked fear or anxiety about a specific object or situation, such as flying, heights, animals, receiving an injection, or seeing blood. Now, they call these objects or situations phobic stimulus. And when it says marked fear or anxiety, what that term really means is that the reaction we have to the phobic stimulus is intense or severe. Now, the second criteria is the phobic object or situation almost always provokes immediate fear or anxiety. Now, I know this one is pretty obvious because the term phobia is defined as an extreme or irrational fear of or aversion to something. So, of course, we're going to be immediately scared or have anxiety about something. But just keep this in mind because the fear or anxiety usually doesn't happen hours or days later or anything like that. Or let's say you're afraid of driving over bridges. It wouldn't be stressful or upsetting to you only 1 out of every 5 times or so that you drive over a bridge. That wouldn't be sufficient in order to be diagnosed with specific phobia. And criteria number 3. The phobic object or situation is avoided or endured with intense fear or anxiety. And in my experience, it's usually avoided as much as possible because it's so uncomfortable to be around. And I've had patients avoid the doctor for years because they're afraid of needles. And only when forced or if there's no other way to avoid it do they go. But they hate it and can sometimes even have panic attacks as a result. The fourth criteria is that the fear or anxiety is out of proportion to the actual danger posed by the specific object or situation, and to the socio-cultural context. Now, the actual degree or fear of anxiety may vary from person to person and situation to situation. It could be anything like anticipatory anxiety all the way up to full-blown panic attacks. And this could be due to the length of time we have to be around the stimulus, or maybe how many other people are around us, or if it's just a particularly difficult situation. Like, let's say we're afraid of needles and the nurse couldn't find a vein and just keeps having to stick us with it over and over. That can be really hard. And also, the fear and anxiety can be expressed differently in children versus adults. And that's really important to know, especially when you're a clinician diagnosing or if you're a parent and wanting to make sure that your child is properly diagnosed. In children, the fear and anxiety may be expressed by crying, tantrums, freezing, or clinging. So just keep that in mind. The fifth criteria is that the fear, anxiety, or avoidance is persistent, typically lasting for 6 months or more. So this isn't something that's just come up for just a couple of days or weeks. It has to be around pretty persistently for 6 months. And the sixth criteria is that the fear, anxiety, or avoidance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. And you know, this is part of every diagnosis. It has to make it hard for us to do what we need to do each and every day. Otherwise, our ability to do what we need to do isn't impaired. And they always focus on the impairment when it comes to diagnoses. So notice your ability to function at work, school, and in your social life as well as at home. And the seventh and final criteria, which is also part of almost every diagnosis, is that the disturbance is not better explained by symptoms of another mental disorder. We just want to make sure that it's actually this that's causing the impairment and not something else. And I also found it interesting that the DSM stated that it's common for people to have multiple specific phobias, and that the average person with this diagnosis has 3 specific object or situations that they fear. Also, approximately 75% of people with specific phobia fear more than one situation or object. So, if you have one phobia, chances are you have another. Which I guess makes sense, if phobias are anxiety driven, we all know how anxiety can only get worse the more we avoid things, and it can kind of move into other parts of our life. And so it's almost as if by giving into these fears and anxieties, we're proving them to be true and kind of making it worse. Oh, and one more thing that I found really interesting, because phobias cause us to be scared and can push us into fight or flight, the part of the brain that they know is involved in phobias is our amygdala and the related structures around it. Because if you don't know, our amygdala is what's responsible for our fight, flight, or freeze. So of course, phobias would trigger that. Okay, now let's get into the good stuff, the treatment options. And the first option that is researched and supported is exposure therapy. Now I know even the name of this treatment scares some people, but the truth is that your therapist isn't going to force you to immediately face your fears. They're going to work with you to build up your calming and soothing resources. Then put together a hierarchy of fears so they know what's most upsetting to you and what's tolerable. And then they're going to work with you to move up that hierarchy, using your resources to help calm you back down all along the way. And the goal of exposure therapy is to change your response to the phobia stimulus by slowly and gradually exposing you to it. But as always, in therapy, you get to set the pace and make sure you let them know if it's ever too much or too fast. Next, there is cognitive behavioral therapy, otherwise known as CBT. Now, the goal of CBT is to better understand your thoughts and feelings about the phobia stimulus and work with you to change any of those unfounded beliefs. Things such as, if I drive over a bridge, it's going to collapse and I'm going to die. CBT also utilizes some exposure techniques to prove to you that the unfounded or faulty belief you had is in fact not true. And just like exposure therapy, this works because exposing you to an anxiety-provoking thing and then showing you that nothing terrible happened and you can still calm yourself down helps you slowly fight back against that belief and get rid of the phobia for good. It's like we're proving to our brain that there really isn't anything to be feared with that particular stimuli. Now, the final treatment option is medication. And like I've talked about in the past, if you aren't even able to participate in therapy because it's too overwhelming or stressful, you may want to try medication for a short time so that you can overcome some of your symptoms and actually benefit from therapy. And there are 3 types of medications that have been shown to be effective when it comes to specific phobias. And those are SSRIs or SNRIs, because if you didn't know, they can be used to help with anxiety symptoms. And so of course, if they can lower our anxiety, then maybe we can participate more in therapy. The second is beta blockers, because they block the stimulating effects of adrenaline, which your body may be producing when you feel anxious, overwhelmed, or scared. And these can be symptoms like heart racing, feeling shaky, sweaty palms, things like that. Adrenaline can even raise our blood pressure and all sorts of things. So but the beta blockers will just kind of bring that down, help us not feel so panicked. And the third medication option is sedatives. And these are things like benzodiazepines. Now, benzos can be very calming and definitely take the edge off of any anxious or on-edge feelings that you may have. But if you have any history of addiction, please take these with caution and let your doctor know. And of course, ask any questions about side effects or any worries you have about medication when you see your doctor before you start taking a medication. And overall, I just want you to know that phobias are very common, but they can be overcome with the right treatment. And I hope you found this information helpful. Thank you so much for watching, and I will see you next time. Bye.